So you mentioned if it's schizophrenia or bipolar disorder, it should be long term. So how long are we like talking about?
So especially you see, because there are a lot of various different studies, okay? So there are various studies which show different, there is no clear-cut definition of how long, but especially with schizophrenia, if this is, you have had more than one episode, you need to continue medications for life, okay? It's like when you compare it with epilepsy, sometimes you may stop after a certain period of time, and in some cases you have to continue for a long term. Yeah.
So you also mentioned like it's obviously not a one size fits all. Obviously, there are many factors to consider. There's different, brain chemistry. You need like social support, how many episodes there are, the family history, and all of that. So apart from like the social like support, like what would be like a holistic treatment plan? Is it like taking psychiatric medications, is that alone sufficient, or is there a sort of a holistic treatment plan you would advise to incorporate into the treatment regimen?
Definitely, that's also a good one. Definitely not. Medications alone are never enough. Almost always never enough. Okay. Support should be multidisciplinary. Okay, it should be integrated support. It should be holistic. So, for example, if you can take all the medications you want, but if you're not making changes to your lifestyle, if you're not glancing, to just take a look at what you're putting in your body, food, okay, your diet. What do you eat every day, okay? If you're not taking a look at your social support, okay? Do you have enough social support? Are you lonely most of the times? This thing matters a lot. How is your physical health, okay? How would you describe your physical health? How would you describe your oral health? That is also, it has been linked. Do you exercise, okay? Therapy matters as well. If you, for example, when you combine therapy, lifestyle changes, and medications, the result is way better than, compared to if you are just doing one of them, okay? So I'll give you an example. For example, studies show that exercise is almost twice as effective as medication, okay? So these things do matter.
Yeah, so I mean that's quite interesting because when we talk of like disorders like mental health disorders, we're mostly focused on the medication part. So I think what I've also like learned today is it's not just the mental health itself. It's the mental health is actually linked to several other types of health. Like how is your physical health? The physical health, the oral health, as you spoke about. The social support system, is the person lonely, even the diet. I mean, that was something new to me as well. So how does a diet, maybe how would that affect someone's mental health?
Gut issues, gut health. I think you have had a talk on the gut brain axis, okay? 90%, up to 90% of serotonin, which is the neurotransmitter that regulates mood, okay? It's responsible to keep you happy, basically. That 90% of that is produced in the gut. So if you have an inflamed gut all the time, if you have a leaky gut, inflammation because of the processed foods that we eat, like seed oils and artificial food colorings and dyes and all of that, okay? Ultra processed foods that are high in sugar and trans fats, okay? Not the good fat, the trans fats. All of these, they definitely will lead to inflammation in the gut. And so if your gut is inflamed, less serotonin, mental health is affected. Yeah.
Okay, so these are the like key takeaways. I'm glad we got a lot of clarity on the subject. The most important thing for all of us is that when facing with such kind of symptoms, we need to seek help through a medical professional. Adherence is important to the medication, to the treatment guideline. If there is any like instances of like intolerance, your medical professional can always like guide you. A psychiatrist preferably can always like guide you on adherence or switching of medication, not to lose hope. And of course, mental health is a holistic good way of life. So we have to look at physical health, social support, oral health, and different aspects of our lives. So what about like side effects? Like what are like common symptoms or side effects to watch out for when a patient starts using these psychiatric medications?
Yeah. So there are definitely a number of side effects, and they usually go by drug class. So antidepressants will have their side effects, and each type of antidepressant, each class of antidepressant will have its side effect, and the same applies for the other groups. But the most common ones, we can group them, are anticholinergic side effects, metabolic side effects, and extrapyramidal side effects, which we abbreviate to EPS. Okay, so in anticholinergic side effects, you may experience things like drowsiness, blurred vision, constipation, urine retention, sometimes orthostatic hypotension as well. Okay, and changes in appetite. Uh, it sometimes does interfere with sexual function as well. Okay, so you need to look out for that. For example, metabolic ones, especially with second generation antipsychotics, yeah, you can have, they do increase your appetite, and therefore your blood sugar as well, your lipid profile will be altered, so you need to look out for that. Your blood pressure. So basically, when you are on these medications, make sure you are regularly going for your lipid profile. You are doing your basic checks like your blood pressure, your blood sugar, your glycated HB, okay, and your body weight, your BMI. You need to have those. So, for example, using certain medications can cause changes in your baseline blood sugar because they cause also changes in your appetite. Okay, you have to be constantly looking out for you. So basically, when you are on these medications, especially the second generation antipsychotics, you need to be, doing your glycated HB. You need to be looking out for any weight gain, especially, and if there's a rapid increase in weight, okay, you need to be getting your lipid profile done at least every 6 months, okay. Other side effects, for example, with antipsychotics, especially the first generation, you will see something that we call EPS, or extrapyramidal side effects. So you might see extreme muscle rigidity or stiffness, okay? You might see a lot of restlessness. With the other medications as well, you have something known as anticholinergic side effects, okay? You might see, and mind you, not everyone will get these side effects. So again, it varies, okay? There might be blurred vision, constipation, urine retention. You might feel drowsy all the time, especially if you're on benzodiazepines, okay? In severe cases, they might also cause respiratory depression and hypotension, okay? The lowering of your blood pressure.
That was very interesting. At least we need to educate our viewers and patients who are currently under psychiatric medications, or people who are suffering from symptoms like depressive symptoms or anxiety
I
symptoms,
think
to be aware.
I would like to tell them, anyone who is using these medications, please be, closely following up with your doctor or your healthcare provider, because you might not think much of it, but you can get support in a form of maybe dose adjustment,
Yeah.
or changing the class of medication, okay. There are some kind of side effects which are, for which they are psychiatric emergencies.
Right.
So, for example, suicidal thoughts or ideations, okay, you need to discuss this with your doctor, okay. Or for example, extreme muscle rigidity, okay, and fever, you need to go to the hospital. So there are a lot of them, and it's better that for every, it's the best way is to monitor yourself. Whatever you feel is not normal with you, is not regular with you, the best thing is to discuss with your
Yeah,
healthcare
so just like you
provider.
said, like monitoring your HbA1c,
Yes.
your lipid profile, any sudden changes in the weight gain and
Yes.
whatnot. But what I've seen, unfortunately, commonly, even like during practice is that usually patients just keep coming for the refills without
Yes.
like without even like bypassing basically unfortunately the consultation, and they just come just give me a refill like, and it goes on like monthly refills.
And
So
it's not only the blood sugar and the lipid profile, it
Yeah.
depends on the type of medication.
Okay.
So there are some medications for which you have to do a liver function at least, if not 6 monthly, then at least yearly.
Okay.
You see, there are some medications which require you to monitor the level of the drug in the in your blood. Sometimes there are medications which require you to do renal function tests every 3 months. Okay, so it depends on the type of medication that you're using. So again, we come back to always keep following up with your doctor. Yeah.
So mostly what I've seen in practice, things like benzodiazepine drugs, and patients is coming in for like monthly refills, and unfortunately that's kind of what I've observed. So what would you advise to patients, who basically that's how they view their treatment, is just come in, take your refill, and just go home. So what would be your message to these kind of patients?
So you see, for benzodiazepines, again, it is a drug that should be, it must be very regulated.
Okay.
You shouldn't use it long term, because it has that property of dependence and tolerance. So what works for you now, you might need double the dose a few months down the line. So that's why, again, we come to the same thing, educating your patient. Psychoeducation is very important. You have to tell the patient that this is not, to be used on a long-term basis. Okay, so we might give it to you now, but then we are planning to taper it down at least by 2 weeks. If not 2 weeks, then a month. You should not use it more than a month. Yeah.
Okay, thank you, Dr. Azra. That was very insightful. I think we got quite a couple of takeaways from this, and I'm hoping that this would be quite helpful for our audience as well. Thank you. So it was really nice having you, Dr. Azra. Thank you so much for sharing with us like your insights, and I hope this will be able to like empower patients and people in general to take control of their mental health with the right support, of course.